It was, of course, COVID-19 or coronavirus, and it spread around the globe with astonishing speed. The number of new cases is literally growing by the hour. As we go to air, there are 93,000 confirmed cases and more than 3,000 deaths across 78 countries. Here in Australia, there have been 45 cases so far, and that number will rise. There are fears about how our health system might cope, and that depends on how well the spread is contained. The world of 2020 is so interconnected from trade to travel that the implications of this virus, from the smallest village to the most powerful country, could be immense. Tonight, we'll talk to experts around the world. Jason Om starts our coverage.
Flags are flying at half-mast at the Vines Country Club north of Perth, where businessman James Kwan was a much-loved member. The 78-year-old died this week, becoming Australia's first victim of the coronavirus.
You could definitely sense that around the club was in sorrow for him. We did have a minute's silence here, and we had a drink for him up in the bar after golf. So. Yeah, it was a real shock when we found out that he'd passed.
James Kwan was on a family holiday aboard the Diamond Princess cruise ship when he contracted the disease. His 79-year-old wife, Teresa, tested positive too, and both were transferred to Darwin for quarantine and then to Perth. Their son, Edwin, also has the disease and remains in a Japanese hospital.
Prior to James contracting the coronavirus, they were having a great time. They were exploring caves and no obviously signs whatsoever of what was to come.
For the Kwan family, travel was both business and pleasure. Born in Malaysia, James built a tourism company in Western Australia.
Very, very astute businessman, but a very wry, sort of dry sense of humour, and that's probably what I'm going to miss the most about James.
But after the business shut down last year, the Kwan family decided to take a break.
We're just fingers crossed for Teresa now that she gets well and gets out of hospital.
More than 600 passengers on the Diamond Princess tested positive, including Australian couple Karen and Jason Honey.
So this is the hospital room, the isolation room that I'm in. Karen's in the room next door and we have basically no contact. So that is our prison cell.
Karen's now into, I think, day 26 or something of the virus, or 24. And I've been in hospital now for about 9 days, 10 days, something like that. So, and I've had a gut full of it too.
Karen's illness began with a few aches, progressing to coughing and a high fever. But curiously, Jason has no symptoms despite testing positive.
I've had no fevers, no coughs, no nasal problems, no aches, no pains, nothing.
So you're feeling fine?
Yeah, I'm fine. I have not had a single symptom of any sort.
Nearly 200 Australians were evacuated from the Diamond Princess, but those who tested positive had to stay behind.
One of the things that is really frustrating is we feel like the forgotten Australians. Our government just left us here stranded.
In Australia, fear of the coronavirus has escalated to panic buying. Supplies of pasta and rice, canned goods, paracetamol, and especially toilet paper are running low. But long before the panic set in, Mary Lee Mai was stocking up.
So you started buying in January.
Yeah.
What was your first thought when you heard about the coronavirus outbreak?
I just thought I'm going to get it for sure. All right. Yes, thank you. Oh my gosh, you're too fast. It's maybe $200 to $300 a shop.
And what's down here?
Down here, there are masks, nappies, toilet paper.
And you've got some medicine here as well?
In an event of a crazy pandemic, pain relief will be at a low. I'm asthmatic, so I just got 2 more puffers. Come this way, I'll show you.
Mary Lee's confident her family of 5 has enough if they suddenly need to isolate themselves for 14 days.
I've also got some seeds, just in case there's an interruption to the fresh food supply chain. As soon as Scott Morrison used that word, use the word pandemic, people are going to go crazy.
I think people are just preparing for the worst case scenario, so yeah.
And I also bought these extra bottles of bleach.
And they're prepared for a new routine of no handshaking, no hugs and no kisses.
Already he's not kissing the kids on the lips or anything like that, but give it a few weeks, I have a feeling it could be the norm.
When a new virus is introduced into the human population, there's a risk that disinformation can take hold, and that's not only unhelpful, but potentially dangerous. The ABC's Dr Norman Swan explains.
In most parts of Australia, we live cheek by jowl. And when something hits that could spread quickly through the community, fear dominates. What's fiction and what's reality? SARS-CoV-2, the virus that causes COVID-19, is new to humans, almost certainly having spread directly or indirectly from bats. Most new infections originate in animals. Some, like avian flu, don't spread easily, while others like SARS, swine flu and this new coronavirus do. There's a lot we still don't know about this coronavirus, including being sure about how it spreads.
We know that it is probably spread by both the droplet and the airborne route, which is respiratory transmission. It is also spread by contact, most likely, which means if someone coughs or sneezes on a surface and you put your hand on that surface and then touch your face, you can get infected.
It's hard to get by without touching anything, so people are wondering what's better, an alcohol-based hand sanitizer or soap? Well, hand washing with soap is probably best because it removes the fat layer on your skin which holds the virus. But hand sanitizer is a very good runner-up. Masks are pointless. Your chances of walking past a person with the illness or being on the same train or bus as them are not much higher than winning the lottery. So by wearing masks, you're unnecessarily using a resource that's needed for health workers who'll be directly exposed to infected patients, and needed for people with the illness to cut the chances of them spreading it.
People over the age of 60 or 65 and people with underlying health conditions are at greater risk of severe disease.
We know who's most susceptible to it, but what are your chances of actually dying from this coronavirus? This is called the case fatality rate. That's the proportion of people who die compared to the number infected. The consensus at the moment is that on average there's a 2% chance of succumbing. But that's not the whole story. The number of people infected is underreported. That's because people with mild or no symptoms are often missed. No one knows the real number, but it's likely that the true case fatality rate is 1%. But that's still 10 times the case fatality rate of seasonal flu. But your individual risk actually depends on your age and health. If you're young and healthy, it's almost zero. If you're older and have other illnesses, such as heart disease, diabetes and lung disease, the fatality rate is closer to 15%. There are no treatments for COVID-19, though some are being tested. The death rate may come down with advanced hospital intensive care and a vaccine, but that might be a year away. In the meantime, what should you do if you think you have COVID-19? Symptoms can be mild or flu-like: fever, cough, sore throat, fatigue and shortness of breath. If you think you might have the virus, seek medical attention, but it's important to call ahead to tell your doctor about your symptoms, travel history or possible contacts. There's also a national helpline on 1800 020 080. And what if you have COVID-19 but don't know you have it?
Asymptomatic transmission is the major problem with controlling COVID-19, and this is the major difference with SARS.
I think we need to be most concerned about people with mild infections, with mild upper respiratory infections that they view as a common cold that might be transmitting this virus.
Until this week, the only cases in Australia were from people who'd caught the virus overseas, then flown here. Now we have cases of person-to-person transmission in the community. So is that a game changer?
The fact that we've had person-to-person transmission is concerning, but it's not the main concern. The main concern is unexplained transmission. When we see a case pop up suddenly in the middle of the community who really has no risk factors and we have no idea how they got it, that's what we're worried about.
Knowing all this, are we panicking and overreacting? Or are the measures being taken around the world essential?
I think this is a very significant public health threat. We haven't seen anything like this before for coronavirus. And so it is worth sitting up and taking notice and taking the public health measures that have been taken.
The Johns Hopkins Centre for Health Security in the United States is one of the world's leading authorities on pandemics and emerging infectious diseases. One of its senior scholars, Dr Amesh Adalja, joined me earlier from Pittsburgh. Dr Adalja, why do these viruses seem to spring up out of nowhere?
It's not that viruses tend to spring up out of nowhere. It's just that we are very poor at surveying unknown infectious diseases. And we know that there are many viruses in animal species that have the capacity to jump into humans. And the issue becomes, how good are we at diagnosing infectious diseases? When there are cases of unexplained pneumonia or unexplained cases of sepsis in a hospital, how often do we actually pursue those cases to their final diagnosis? And the answer is not very often. And we really need to get better at surveying human populations for unexplained illnesses so that these don't seem like they're coming out of the blue, because there really are signals that we're missing.
As you say, people will remember other respiratory pandemics like SARS and MERS. Do successive events like this get worse in terms of mortality and severity, or are they just different?
Each of these events is different because each virus has different characteristics. So if you look back at SARS in 2003, it had about a 10% fatality rate, and it was something that wasn't very transmissible between humans. It only caused about 8,000 infections. MERS has a much higher mortality rate of about 30%, but it again is also not very efficient in transmitting between humans. It's primarily transmitted from camels to humans. And this virus seems to be different in the sense that it's not nearly as fatal as either SARS nor MERS, but it is something that transmits more like what we call our community-acquired coronaviruses that cause about a quarter of the cases of the common cold. And that's why we're seeing this virus really take off, because it has that capacity to spread very well. And just because it can spread so well, that's really going to make it a burden on populations, because if it infects a large population, a large proportion of the population, even a very low mortality rate can be substantial because of the number of people that are infected.
Is it possible that some people will just have cold-like symptoms and never even realise that they've had coronavirus?
It's definitely true that the majority of cases are going to be very mild, and many will be indistinguishable from the common cold, which makes it much harder to actually diagnose these cases without diagnostic tests, because the symptoms are so nonspecific. Fevers, cough, sore throat, runny nose, sneezing. Those are the symptoms of the common cold, and that makes sense because coronaviruses are a major cause of the common cold, and this one can cause common cold-like symptoms in a large majority of patients, and only a very small minority get severe symptoms such as pneumonia.
Does a country like Australia have much natural protection because of its geography?
There's often something said that island nations tend to be much more insular when it comes to infectious disease threats, that they're able to fend them off and protect themselves more. But I don't think that's the case with an island like Australia, because that is a very cosmopolitan nation that has individuals from all over the world. And we know that this virus had been spreading since at least November in China. So that was a long head start that this virus had to spread all over the world. So I don't think that Australia will be spared from this infectious disease, just like any other country in the world.
And how far away is a vaccine for coronavirus?
Vaccine development is measured in years often, and sometimes even decades. I do think that we're moving rapidly with this vaccine, and we hopefully will have enough vaccine, if everything goes perfectly, in about 12 to 18 months to vaccinate those at-risk populations in the world.
Dr Amesh Adalja, thank you very much for your time.
Thanks for having me.
Any medical outbreak puts all sorts of demands on Australia's health system as well as other government services. Authorities have to consider everything, including how schools, public transport and emergency services should prepare. Chief Political Correspondent Laura Tingle takes a look at how they make decisions.
A long thought-out plan for how government would deal with a pandemic in Australia is swinging into action.
What the impact of this virus will be.
And it's the people in this national incident room who are calling the shots.
No one believes that number.
The first weapon in their armoury is a powerful new law. Australia's old Quarantine Act was introduced more than 100 years ago, originally to keep out smallpox and leprosy. Amended more than 50 times since, it was becoming unwieldy. Enter the Biosecurity Act 2015, a major overhaul of the powers the federal government can wield to limit the spread of disease. On January 21, Australia declared the novel coronavirus a disease with pandemic potential under the Act, activating its powers. The Act allows for lockdowns of large areas, like the control zone in place for the detention centre on Christmas Island. Control orders can also be used to force individuals to comply with medical instructions. Police can use force to put people in detention if necessary, but so far authorities say no compulsory orders have been needed.
My priority is to keep Australians safe.
The spectre of coronavirus spreading in Australia has emerged this week, and we're now contemplating these biosecurity powers being used within our borders. Last Thursday, the federal government declared a pandemic was underway.
It led to us standing up the fundamental pillars of the government response. The National Incident Centre, which is effectively a health crisis centre within the Department of Health. The National Medical Stockpile, which is a series of warehouses around the country. And then the National Trauma Centre, which is based in Darwin, but it has a network of what are effectively the SAS of doctors, nurses, health workers and logisticians.
The plan also sets up the testing regime for the virus and for coordination with sectors like education, emergency management and transport if cases escalate. At this point, the focus is on containing the disease, particularly in one of the most vulnerable sectors, aged care. Emphasising the risks, it emerged today a worker in a Sydney facility had the disease. The death of one 95-year-old resident and the illness of another is being investigated. Staff are being isolated and 11 residents placed in quarantine.
We have to look at the staffing because aged care staffing, that we may need a surge workforce. We may need to provide some additional nurses that can come into a facility which has an outbreak to help those staff manage the complexities of isolation and infection control.
So if you have a relative or an elderly relative in a nursing home or aged care facility and somebody is diagnosed with this disease in the facility, are you actually going to be able to visit?
If there were an outbreak in a particular community, yet there wasn't anything in the facility, we might want to protect the facility by stopping people coming in. But if you've got, for example, the 11 people in the facility in New South Wales, they don't have the disease, they're just being quarantined, we will require their relatives to wear protective equipment when they come in. So it'll depend on the circumstances, but there may be circumstances where to protect the residents we may have to reduce or stop visitors.
An early sign of some of the much more profound changes this disease might bring to our lives than hoarding toilet paper.
The World Health Organisation's primary role is to direct and coordinate global health policy across members of the United Nations, and that includes taking the lead on outbreaks such as COVID-19. Dr Margaret Harris joined me from the WHO in Geneva. Dr Harris, why is this virus causing so much more concern than, say, a regular strain of winter flu?
It has the ability to infect very large numbers of people. At the moment, we're looking at a mortality rate of about 2%, and a lot of people say, 2%, I don't have a problem. That is a huge number of people. It has already killed more people in 7 weeks than Ebola has killed in our second worst outbreak in the Democratic Republic of Congo in nearly 2 years.
Why is coronavirus spreading faster in some countries than in others? For example, why has Iran become the biggest hotspot after China?
Some of the reasons are that in some countries, people are very, very close together. They've got very dense populations. They don't really have the opportunity to do what we call social distancing. That's keeping a couple of metres away from people when you've got a contagious virus like this spreading. It's a lot easier in Australia than it is, say, for instance, in Wuhan in China.
There's been some suggestion that the World Health Organization was slow off the mark, that it cut China some slack because China is a major donor to the WHO. What do you say to that?
None of that's true. And we weren't slow off the mark. It's interesting, WHO is everybody's favourite whipping boy, and we accept that. We always want to do better, and if people criticise us, it helps us to do better. But no, we weren't slow off the mark. They notified us in December. We had people in there. We've got a large country office. They were very, very open. And one of the main reasons we know what this virus is and had a test in a couple of weeks was because China shared that data. In fact, this has never happened in an outbreak of a new virus before. It's unprecedented.
Dr Harris, thank you.
That's a pleasure.
The Australian economy grew by a better than expected 0.5% in the December quarter, but those figures reflect the period right before the worst of the summer's bushfires and the coronavirus outbreak. So far, the tourism and higher education sectors are taking the brunt of the fallout from coronavirus, but the effects will be economy-wide, as Peter McCutcheon reports.
Facing towards the shoreline, or you guys will be facing towards that way.
This Gold Coast surf school caters for groups of up to 20, mostly international tourists.
And then we'll get going.
Today, it only has a class of 4.
We're 60% down on last February, and we had predicted about a 30% increase, so essentially 90% down.
The Chinese tourist market disappeared almost overnight after the outbreak of the coronavirus, and now the crisis is spreading.
Korea would be our next market, led by Japan, and that's all falling apart. So
it's a disaster not only for tourism on the Gold Coast, but throughout Australia.
The impact is really quite severe on tourism. We heard yesterday from the head of Tourism Australia that bookings are down 30%, and this comes off the back of the bushfire crisis as well. So many of those small operators would be really struggling.
Australian universities are also on the front line of the coronavirus fallout, particularly the sandstone universities that have relatively high numbers of Chinese students. The University of Sydney has already announced temporary cuts to capital spending.
The universities are just going back over the past few weeks. Some of them aren't fully back. Some of the universities have delayed the start, but there's still a significant proportion of overseas students that haven't been able to come back to Australia.
The Queensland University of Technology says it's not as badly exposed as others. More than 16% of students here are from overseas. The university has more than 500 students still in China, and it's looking increasingly likely they'll have to defer at least one semester.
We've really been focusing on ensuring that we've got the best support for our students. We do have estimates of what it would cost in worst case scenarios, but we're a long way away from making that call. The more long-term issue is that it will, if it goes on, if it went on for another semester, for example, we would have to look at our building projects and what we have to pause in relation to our risk profile.
For other Australian businesses, it's the disruption inside China that is causing headaches.
There's a big impact on the agriculture sector, who are unable to sell into the Chinese market at a peak time, the Lunar New Year, which is one of their best times. So lots of specialist food producers not able to sell.
It's certainly put a bit of a dent in the last 2 months, a big dent in our income, but it's probably millions of dollars of income that we haven't seen through the business.
Adelaide-based lobster exporter Ferguson Australia sends nearly all its seafood to China. The company hopes it can claw back some of its losses if the crisis ends soon.
Our fishing boats have all stopped at the moment due to the virus, and so has the rest of the fleet, and the season usually finishes at the end of May. So we've still got a little bit of time in the season to keep catching the quota.
Concern about the virus is spreading, with the latest Ipsos polling showing 40% of Australians believe it will have a personal financial impact. Even businesses that have no direct link to China will increasingly feel the pinch as business confidence takes a dive.
We've obviously seen stories about panic buying of toilet paper and hand cleanser and baked beans, and so that's good for sales, but obviously there's only a certain amount of those things that you can use. But it's really more how it feeds into uncertainty about these broader spending and investment decisions.
And the longer the crisis goes on, the more the disruption will spread throughout the economy.
It's really hard. As a small family business, our priority is pretty much just keeping staff so that when everything does turn back on again, we're good to go.
One of the world's best-known historians is Dr Niall Ferguson. He has a particular interest in the way pandemics have played out over centuries. He's with the Hoover Institution at Stanford University in California and spoke to me from there. Dr Ferguson, how does coronavirus compare to other pandemics throughout history?
Well, of course, it's not going to be the Black Death of the 14th century, nor is it going to be as severe as the 1918-19 influenza pandemic, which probably killed more people than World War I. But it does seem certain to be more economically disruptive than any of the more recent pandemics since World War II. There have been some big influenza pandemics. Then there was SARS, which in some ways resembles this new coronavirus, was more lethal but did not spread so far and did not cause as much economic disruption.
How have pandemics rated among other historical threats to humankind, so natural disasters, wars and so on?
Well, I think what happened in 1918-19 illustrates how enormously dangerous a mutant virus can be to humanity, because if you think about the numbers who were affected, and that runs to the tens of millions on any estimate of killed, then this is in some ways the biggest danger that we face as a species, aside perhaps from nuclear war, because it can happen so swiftly. Now, medical science has made great advances in the past century, so we're better equipped than the people of 1918-19. On the other hand, the world has got much more interconnected and travel times have been drastically reduced. So in that sense, I think we are very vulnerable.
How do pandemics eventually end?
In some cases, things are localized simply because they're so lethal that they can't spread very far, and in that sense they're relatively easy to contain. If something only kills a relatively small proportion of the people affected, but is very contagious, as seems to be the case with the new coronavirus, then what happens is that it spreads very widely. A substantial proportion of people end up getting it, and the epidemiologists that I talk to, and remember, I'm a historian, not an epidemiologist, they tell me that you could expect something like this, a bit like influenza, to become, as it were, part of our ecosystem. But given what we know about it so far, then the likely way in which this ends is A, we arrive at medical remedies, vaccinations and treatments, and B, then the majority of people who encounter it survive it, and we gradually build up what's sometimes referred to as herd resistance or herd immunity. And that seems like the most likely scenario in this case.
Niall Ferguson, thank you very much.
My pleasure.
That's the program for tonight. Thanks for your company. Good night.